Last night, the incisions near my temples, like right here and right here and a little bit right here. That's not my temple, but they were stinging and itching. So I was like putting pressure and patting it because I know I can't scratch them. And then, so I put a little pressure and then it felt wet. And then I noticed, oh, it's pus. So I know in the aftercare, and it's been like a month, right? So in the aftercare, it says if there's pussing, it's not excessive, but enough for me to worry. We contacted the doctor, and I now have an appointment for tomorrow so they can check it out. They told me not to worry, but I worry about a lot of things because, I mean, I'm still coughing, which isn't normal. Hopefully it's nothing too bad and everything's okay, and they just give me antibiotics or something. So I have my appointment at 1:30 today to talk about the pus that's coming out. Not a lot. It leaked a little bit this morning, but that was it. I don't like my hair like this, but I'm wearing the headband to cover the incision marks, so I'm ready, just waiting for Rob to pick me up. So I came home from she said it looks fine, not to worry, but if it keeps happening, to contact again. But she did send me home with some antibiotics for like 5 days. So hopefully that fixes everything, because when she was pushing it at the office, it was not leaking. When I got home, it started leaking. So I don't know. Luckily, when it leaked, I quickly took a picture and then I sent it to her, and she said, "Thank you for the update. Yeah, definitely take the antibiotics. And then if it gets any worse, to let her know to contact her and stuff." So yeah, so hopefully the antibiotics help, because I don't want it to leak anymore. Plus, this one's kind of sore, like a really dull pain. Hopefully the antibiotics help. So I noticed some leakage here and some leakage here. I don't know if it's because I'm putting pressure on it, but I think I shouldn't. So I'm not going to put any pressure. I was just cleaning it with some cotton swabs. And yeah, pus came out. This side kind of a lot. This side not really, but maybe I shouldn't put any pressure because now it's kind of like a dull pain. I think I keep opening up the wound, and I don't think that's good. So I'm just gonna leave it alone from now on. Hopefully it gets better. If not, I'm gonna have to let them know and go to the hospital again. I'm gonna make a note of it. It looks like this part is getting lighter. I don't know, I can't tell. She didn't say anything when I went to my appointment yesterday, so it should be fine, I guess. I know technically my second pre-op appointment is gonna be on the 24th, and I know that's when they're gonna tell me how to take care of it. Like, I don't know, bacitracin, whatever have you, because they told me to wait till that appointment to start doing that. Hopefully because it's mainly over here in this area. But yeah, hopefully it starts healing better, so no more pressure on it.
How are you?
How are
How are you
you?
feeling?
Hi, I'm good.
Any drainage?
No,
Redness?
no.
Awesome. So the antibiotics help?
Yes, thank you for that.
Yeah, I was just talking to Emily. I'm like, well, after you sent us that picture, I was like, I did not. It's so I did not. I wasn't able to get anything out. So I'm happy you sent us
I know,
that.
because like I got home and then I was like, oh no, it's doing that itchy thing again. So I put pressure and I was like, of course it leaks now.
All right.
Of course.
That's always the way. Yeah, I mean, it looks good. Um, obviously the antibiotics, I messed up your hair in the back. I'm
Oh
sorry.
no, it's okay.
Antibiotics helped.
Mhm.
I don't see any redness. When I'm pushing, I don't feel any fluid pockets, but
Okay.
should that come back, definitely let us know.
Okay.
No fevers or pain?
No.
No, okay. The things that we'd be concerned about is if that happens again, if you start to get like red or swollen, pain, fever, obviously definitely let us know. But I think overall everything's looking good.
Okay.
I don't see any concern now. I think the antibiotics helped.
Oh, awesome. Thank you.
Awesome. Any questions that you have?
I do. Like for instance, well, I have a few. When can I use like a different type of, instead of gentle, like move on from gentle
Sure.
shampoo?
You could switch now.
Oh, okay,
Yep.
yeah, because like I have really bad like dry scalp.
Oh, yes,
and
you
I'm
can.
like trying. Yeah, I need to start using something else. And also, next question is, um, is there stuff I can put on to to I guess reduce scars?
Yeah, so it's a good question. The hairline's a little bit tough because there are like silicone strips and certain things that you could try, but those are adhesive, so it might stick to the hair. At this point, are we 6 weeks yet?
311, so it's
So the main thing I would say once you get to 6 weeks
we are.
is perfect.
Oh, okay.
So you can start massaging it.
Okay.
That and so it's basically like firm circles like
Okay.
that all along the scar.
Okay.
Do it 3 to 4 times a day for 2 to 3 minutes.
Okay.
You can certainly try silicone-based products. You don't have to.
I don't.
They make like a gel. The other thing now that it's getting warmer and you're probably going to be outside more is sunscreen.
Oh, definitely.
And also protecting it, like wearing a hat or whatnot.
That was
if you're gonna,
my next question.
Yeah, yep. Sun can darken a scar. The pink that you see now is normal. That's gonna fade over time.
Okay.
So I would say massage, sunscreen. I've had patients try like vitamin E, that's pretty benign, silicone gels, but really the massage and the sunscreen is his preference.
Okay. And as for makeup wise, like say if I have to run errands to like
Sure.
Oh,
Yeah, you're 6 weeks now, so I think that's safe. Yeah.
So I can also and also sunglasses. I can set
Sunglasses are fine.
Perfect.
Yep.
Okay.
Yeah.
Well, that's pretty much it.
Awesome.
Yeah.
Yeah, I think you look great.
Well, thank
I'm gonna
you.
take. Is there my phone? Let me grab up my phone and I'm gonna take some pictures for him.
Sure.
And then you're probably scheduled to see him
Yeah, my next
3
schedule's-
months.
Yeah.
So we'll keep that, but if anything happens, we'll see you sooner.
Yes, beautiful. So cute. My scalp is so dry though.
Yeah.
Have you ever heard of Soul Train? Yeah. There's a woman who like had this beautiful hair just like yours, and you remind me so much of her. Oh my gosh, I think I know. You know, everybody knows. You know Soul Train. You know that. Yeah, lady. That's definitely a compliment.
Thank you. You too.